Hi everyone, this is Michelle coming to you from Neuromuscular Massage, and today I want to target the question, is every single muscle pain appropriate to receive a massage therapy session? And the answer is yes and no, kind of depending on where that muscle pain is coming from or what the derivative of that muscle pain is. So oftentimes for a massage therapist, when we see a very sore person, we're very excited because typically it is due to repetitive motion or muscle strain or something that's normal. It's just a healthy muscle that's tight and just needs a good massage to kind of work out the tightness, work out the kinks. Or when it comes to neuromuscular massage, it can be wonderful as well if you're doing some type of rehabilitational case where you need to work on that muscle tissue to get it functioning again. However, there are some cases that are really unique. For example, if you have bacteria or viral infection. You can have a client coming in to see you complaining of neck pain or muscle aches throughout their body, and you're thinking as a massage therapist that this is appropriate. So one particular case might be Lyme disease. Now I've seen a couple of clients that have come with Lyme disease, and they're usually at the end stages of this particular case. And it is really uncomfortable, and it can be really confusing if you haven't been diagnosed appropriately for this disease. So basically it's a bacteria that you can usually get from deer ticks by going out into the woods or whatever the case may be, and you're infected, and it can feel in the beginning very much like flu-like symptoms. So you can be tempted maybe to get a massage, but just know that this is definitely something that is in your circulatory system, and it's also affecting you neurologically as well. So even though a massage may feel good towards the end when you're recovering and it's not in an acute stage, massage is safe. However, just be aware that massage isn't always appropriate when you do have Lyme disease or a bacteria infection or a viral infection that is causing those aches and pains. Something else that people might not really take into account is medication. Sometimes people come in and they're on a lot of medications and they kind of forget, and they're taking the medications are actually causing muscle cramps. So sometimes I hear of leg cramping at night or just random cramping, and the client doesn't really know where it's coming from. Well, it turns out that they are on a long list of medications that really is inducing this type of muscle tightness and muscle cramping, which makes it really uncomfortable for them, but is kind of misleading, especially if you don't relay that information to your massage therapist. You can think that it's due to extensive walking or standing or maybe walking around the mall or things like that, but in fact it's due to your medication, and no amount of massages can really help out with that. Maybe in the time being it can kind of soothe the muscle if there's been a significant amount of cramping because the muscle is sore, but the actual origin of the muscle cramping does come from your medication. So I hope this answers your question in regards to is every type of muscle soreness or muscle pain appropriate for a massage? And again, the answer is it really depends on the stage of what's going on for that particular case, whether it's a viral infection, whether it's a bacterial infection. You definitely want to wait until any inflammation has gone down and it's not an acute stage, which means that there's a flare-up. If it's post or if it's leaning towards the end, then it's pretty safe, but you definitely want to check with your doctor. And also it can come from a long list of medications, a blend of medications. So just be aware that all types of muscle soreness doesn't always come from stress or tension or repetitive use. It can come from other sources as well. So it's really important that you check it out with your doctor, your physician, and receive a proper diagnosis. Thank you so much. Again, this is Michelle from Neuromuscular Massage. If you want to check out my blog or contact me, you can do so at www.luminamassage.com. And until the next video, see you then. Bye.